All right, here we go. So we're going to start talking about semaglutide, everybody. We can get lots of questions about semaglutide, what it is, what it does, how it works, what to expect, what you can do, what you can't do, all that stuff. So we're going to start from the top. So semaglutide falls into a class of medications called GLP-1 agonists. GLP-1 stands for glucagon-like peptide. It's a hormone that's naturally created by our body that helps with digestion of our food, managing of our blood sugars, things like that. So other medications that fall into this class of drugs would be Ozempic, Wegovy, Mounjaro, Rybelsus, Trulicity, Saxenda, things like that. We're offering semaglutide, which is the generic for Ozempic, Wegovy, and Rybelsus. How it's going to work is we're going to do a once weekly injectable, usually into our arm or belly or our thigh. It's not painful, it's water-based, so it's not thick like a vaccine. It's very well tolerated. We use some of the little Botox needles that we use, so it's really comfortable. What's going to happen is the medication works by reducing the amount of glucose that our liver makes, increases the amount of insulin that our pancreas makes. It also helps by reducing our appetite, and it delays gastric emptying, which means that when you do eat food, the food stays in your belly a little bit longer. So you stay full long, you don't feel the need to eat quite as often. What we're experiencing from these injectables is a weight loss of between 10 and 20% of your current body weight. Now that's going to be variable from person to person, but that's roughly what the studies are showing, what we're seeing in our clinic as well. The rate at which people are losing this weight is between 1 to 2, maybe 3 pounds per week. So if you think if you're doing a weekly injectable, you're saying you're losing 2 pounds a week. By 4 weeks, you're 8 pounds down, right? So we just kind of continue this for several months and we eventually get to our goal weight. People also ask about side effects. What's going to happen with this? Am I going to balloon back up as soon as I stop taking it? So most common side effects that we experience are typically GI in nature. So indigestion, heartburn, upset stomach, possibly some constipation or diarrhea. People mostly complain about nausea. It's not the most common thing that happens, but it's the one that we typically get a phone call about. We are able to help manage with some anti-nausea medications. People also report that eating a small meal or drinking some water is very helpful for managing those symptoms as well. When people are going to get these side effects, if they're going to happen, is typically the day of or the day after their injection. And about 5 to 10% of the people get some sort of these side effects, which is normal, but that also means that 90 to 95% of the people aren't going to get it, right? The way that we manage some of these side effects is based on our dosing. Everybody starts at a relatively low dose, and we slowly work our way up based on that, based on the effectiveness of the treatment, how you're feeling, things like that, and that's a better way to manage your weight loss and the side effects that you're having. So what do we require? So everybody gets a consult. Everybody will chat with one of our providers and make sure that they're a good candidate for the treatment. We also require some lab work to be done to make sure that everything is good with your lab. So A1C, glucose levels, thyroid tests, things like that we'll do. And there's a list of people that cannot get it. So people with multiple endocrine neoplasia type 2, a personal or family history, people with a personal or family history of medullary thyroid cancer can't take it. People with diabetic ketoacidosis, it's not for type 1 diabetics, it's not for people with a history of pancreatitis, cholecystitis, or gastroparesis. Can't take it if you're pregnant or breastfeeding, gotta be 18, can't be allergic to it, and you can't take it with other hypoglycemic type medications, so insulin, sulfonylureas, or other GLP-1 agonists, and it works. It works very, very well.